Hi, my name's Cindy Farr, and I'm the Incident Commander for the Missoula City County Health Department's COVID-19 response. Today is Tuesday, February 2nd, and this is my COVID briefing. First, I just want to say I'm sorry I missed y'all last week. I was out sick all week, but now I am back. So let's start with the numbers. We've had 7,726 cumulative positive cases of COVID in Missoula County to date, with 21 new cases since yesterday. We've had 81 deaths associated with COVID-19, and currently 14 Missoula County residents and 6 non-county residents remain hospitalized in Missoula County. We currently have 179 active COVID-19 cases. Those active cases and their identified close contacts do remain in isolation and quarantine and are being supported as needed. Our current average incidence per 100,000 people has dropped to 23. And that's great news. All of these numbers, as well as the graphs and figures associated, are on our website at missoulainfo.com. The state of Montana is reporting 94,384 cumulative COVID-19 cases, which is up 317 new cases since yesterday. There are now 3,593 active cases, with 116 active hospitalizations across the state. And there have been 1,249 deaths related to COVID-19 statewide. The University of Montana has had 612 cumulative associated cases since the beginning of fall semester back in August, with 2 new cases reported since yesterday. There are currently 13 active associated cases. Across the state and across the nation, we are seeing a downward trend in case numbers. While this is very encouraging, it is still important to practice those prevention measures that we've been doing for nearly a year now. Practice that social distancing, wear a mask when you're out in public places, keep your social circles small, and continue that frequent hand washing. With the vaccine rolling out, we would like to think that we're nearly out of this pandemic, but we are still seeing COVID transmission. There have now been 3 distinct variant strains that have been identified across the world, and 2 of those have made their way into the United States population. We have not identified any of those variant strains of COVID in Montana yet, but the State Public Health Lab is actively testing samples to watch for those strains. Right now, we do not have much data on these variants, but believe that the vaccines that are currently being distributed will prevent you from getting infected with the variant strains as well as the original COVID-19 strain. And we can talk more about that as more research comes available. So now let's talk about vaccine distribution. Here at the health department, we've set up a vaccination clinic at the Old Lucky's Market in Southgate Mall. We did a mass vaccination clinic for those who are in phase 1B and are 70 years or older and are Native American or persons of color. Our first clinic was last Thursday, and then we had another clinic on Sunday. These 2 clinics gave us an opportunity to test out our strategy and make necessary changes to ensure that we have a smooth process going forward. We received a lot of valuable feedback from the community about our sign-up system and the difficulties that system presented, and we are exploring other options to make that process easier. In the future, we will put our sign-up system for vaccine appointments on a regular schedule when our vaccine supply stabilizes and we get predictable notice as to when and how much vaccine we'll be receiving. This week, the state did not directly give us at the health department any vaccine, and we're working with our community partners to figure out how to best share the vaccine allocation across the county in order to best serve you in the community. We super appreciate your patience as the vaccine is trickling into Missoula County at about 1,200 to 1,500 doses per week. We do hope that the supply will increase, but we're doing the best with what we have available to us right now. We are exploring better options for giving notice when our sign-up system is active. While the national vaccine shortage continues to make supply and our ability to hold clinics really uncertain at this time. We currently have no plans to create a sign-up list or a waiting list. With roughly 40,000 people qualifying for vaccine under phase 1B, we believe that if we were to create a list like that, it would be incredibly hard to manage. In our past experience with H1N1, we found that the wait list only creates bottlenecks and really slows down the process. For those of you out there who are primary care patients of places that are offering vaccine, we ask that you try not to sign up for a vaccination through a public clinic. Because you have access to a vaccine resource that's not being offered publicly, we ask that you not take away the very limited public appointments. However, if your private provider signed up to give vaccines but is not being given any doses, you're still definitely welcome to book an appointment at one of the public clinics. A list of private clinics that are offering vaccine to their patients can be viewed at covid19.missoula.co. To date, Missoula County has given out 12,911 doses of vaccine. While this process has been painfully slow due to the national shortage of vaccine, the only county in Montana that has given more vaccine as of right now is Yellowstone County. If you'd like to see the numbers of vaccine distributed across the state, please check out the COVID map on the DPHHS website. At the top, there's a tab to show a map of the vaccine distribution. Lastly, I would like to encourage you to please read all of our information on vaccines and the FAQs on MissoulaInfo.com. And please take a look at the vaccine information at covid19.missoula.co before emailing us with questions. We are receiving hundreds of emails, and we're finding that many of the questions that people are asking are actually already answered on our website. So if you have access to the web, definitely take a look at those FAQs and see if you might be able to get your questions answered that way. That is it for my daily briefing today. I know that was a lot of information into a very short amount of time. I will be back on Thursday, and hopefully we'll have some updates for you then. As always, you can subscribe to me on YouTube under my name, Cindy Farr. That's CindyFarr. Click the notification bell so you get notified when additional videos are uploaded. You can follow us on Facebook at the Missoula City County Health Department's Facebook page. And again, check out our website at MissoulaInfo.com. You can also schedule an appointment or ask any questions that you have about COVID if you call 258-INFO. And that is it for today. Until Thursday, everybody, stay healthy.